So, hi, I am Dr. Naveen Mehrotra, Chief Neurosurgeon at the KIMS Sunshine Hospital, Secunderabad. So, now today I will be sharing my experience with the treatment of brain tumors. So, we have seen the patient having brain tumors. So, once we hear that, we have lot of myths about the treatment of brain tumor. So, first of all, surgery remains the mainstay for the treatment of patient with brain tumors. So, surgery is of two types, like opening the skull and removing the tumor, that is called as craniotomy. And the second is employing the minimal invasive surgery techniques to remove the tumor. So, with the advancement of anesthesia, localization of the tumor, neuronavigation, meaning that localizing the exact location where the tumor is and employing them with minimal incision to remove the tumor is called as minimally invasive surgery. So, for that we require specific instruments called as endoscopes. So, each patient has its own the location of the tumor decides whether this can be removed by a minimally invasive tumor or it can be removed by an open technique. There are few locations like the pituitary tumors where we have given up the open surgery and we do the entire removal of the tumor giving via nose, and that is called as endonasal transsphenoidal removal of the pituitary tumors. Deep-seated tumors like intraventricular tumors we remove via endoscope. A very minimal or a small incision is given and we reach the site of the tumor and we remove it. If the tumor is very big and it is involving a large area of the skull and a large pressure effect or mass effect of the brain is there, then we usually employ the open technique and remove the tumor. So, for benign tumors, once they are removed, it is usually the treatment of choice, and once complete tumor is removed, we just follow the patient. But once the tumor is not removed completely or we feel that it is unsafe to remove the tumor completely, then we employ the radiation to arrest the growth of the residual tumor, or if it's a malignant tumor, then we give so that the recurrence doesn't happen. So, radiation has also become very safe in context with brain tumors. So, right now we give conformal radiation, meaning thereby we give the radiation exactly to the site of the tumor so that the intervening brain parenchyma doesn't get affected and we have very least or minimal side effects because of radiation. Number 3 is, if apart from radiation we also give chemotherapy, that means the drugs which stop the progression or multiplication of the tumors, and especially it is considered as an add-on for radiation, and especially in children who are less than 3 years of age. So, chemotherapy becomes one of the star indications to be associated with surgery for the treatment of brain tumors. Apart from that, there are a lot of new researches which are going on in the treatment of brain tumors, in which we are forming some antibodies or immunotherapy. We are giving some gliadal wafers at the site of tumors to reduce the recurrence or treat the tumors. But overall, once what is best suited for the patient is decided upon what is the biopsy report, what grade the tumor is there, what location of the tumor is there, and what is the age of the patient. And then depending upon the board which we have, a tumor board, we decide what is the best for the patient. So, one of the recent advances which we have seen for surgery for brain tumor is called as intraoperative monitoring. Meaning thereby we have the risk that whenever we operate upon the brain, there is a possibility that we may develop a deficit or a weakness or paralysis of one side of the body. But now with safe anesthesia and intraoperative monitoring, we are able to dissect out the tumor and preserve the function while doing the surgery. So, it requires that attaching your hands and legs with wires and connecting them to a monitor, and when we reach the area of the tumor which is surrounding the normal cortex, so we stimulate and see. If we are able to generate the response, it means we are hitting a eloquent area of the brain and we try to avoid that area. So, with the help of this intraoperative monitoring, safe maximal resection is the new thing which we are doing, and it definitely helps us in coming out with the safer or with better outcomes. So, intraoperative monitoring is one of the new recent advances which we have employed for safe resection of the brain tumors. Thank you.